Thank you, and good afternoon. As we've all seen, a trend that's continuing is the massive and significant increase in our number of COVID cases, both increases in COVID cases, increases in ICU, increases in hospitalizations. Today we have another day of more than 2,000 cases. And it's important to put in context, it was not that long ago where we might have 200 or 300 cases a day, and now we're routinely over 2,000. And this highlights the challenge we face when we have exponential spread. It is community-wide. It is in every neighborhood. It's in every part of our community. It's obviously impacting our healthcare system. You're going to hear from one of our hospital CEOs today, and we're grateful for and appreciate our medical professionals and everything that they're doing. But what we have to do is change that trajectory, and we have to go in a different direction. The regional stay-at-home order is designed to do that, and the aim of the regional stay-at-home order is to get people to stay at home. Wearing the face covering, physically distanced, washing your hands, those are all important. We've talked a lot about riskier activities and less risky activities, but the simple reality is when you have as many cases as we have and it's spreading as fast as it is, there are very few settings that are safe, which is why the aim and intention of what we're doing right now is to try to limit the interaction of folks who are not a part of a household unit. And by limiting that interaction and by coming into this for a shorter duration, the state has set a minimum of 3 weeks. If we can come in with the focus and the attention to say things that might otherwise not be as risky, but because of how high the case count is, because the higher percentage that if folks would gather in, say, an outdoor dining establishment, well, now the higher likelihood that someone in that group is positive, it increases the danger, it increases the risk. And so the aim of what we're doing before us is to have people have less interactions with one another in an effort to try and stop the spread and trajectory. When you think about every positive case, right, transmitting it to one or maybe a little bit more than one other person, you see that we have to take actions. And so that is the nature of what we're doing. The regional stay-at-home order is just designed to get people to stay at home. If you have something essential you have to do, you have to get food, you go to the grocery store, do it safely, responsibly, go back home. When you go to work, if you have an essential job that is not possible to work remote, then we go to work, be safe, be responsible, and then go back home. And look, we know it's hard. We know we're at the end of a long year. We know folks are tired. There's fatigue, there's frustration, there's divisions within our community. But we see what is happening to our numbers, not just here, but all we have to do is look around the state of California and look around the country at places that were in a little bit worse circumstances than us, that did not take early actions, preventive actions, did not try and intervene in the situations they are facing right now. We don't want to waste an entire year of sacrifice by getting so close to hope on the horizon with the beginnings of vaccine distribution to throw away all of that progress and sacrifice. Supervisor Cox mentioned the holidays. I know how much you love being with all of your family members, but this holiday and this season, because we love our family members and because we want to protect them, we've got to limit those interactions. We've got to change the trajectory of where we are. And by limiting the amount of folks who are interacting, it limits the potential for that virus to spread and can help us. The situation we face now is much more significant than what we faced in June and July. We know similar actions that we took in June and July were successful. We simply have to repeat them, but we have to repeat them with a vigilance that is even greater than what we did there. It was mentioned earlier, and we're going to hear from our healthcare professionals about what they're seeing. Yesterday, we were fortunate at our Board of Supervisors meeting to have a presentation from Dr. Natasha Martin, Division of Infectious Disease and Global Health at UC San Diego. And I won't share her entire presentation with you. It is available online, but I did want to share this one chart that will really point out to you what we are facing and the great concern around, in particular, the ICU utilization. And again, the capacity here that we're talking about is based on available beds, and there's a great challenge around staffing that our healthcare experts you'll hear from will talk about. But here you can see that barring no action, we were on a pace to overwhelm our ICU bed capacity just before Christmas. And that doesn't mean getting below the 15%. That means going beyond the capacity that we have. If we do the 3-week, the state had said for a minimum of 3 weeks, you can see how that trajectory changes and flattens and begins to come down. And then if various scenarios of how long we would do, you can see the present there. But I think that this chart shows us the trajectory that we were on what we were facing as a region and why we have to come together and come together now in order to make significant progress here. And this is certainly something we think about, we monitor, and certainly a driver behind a lot of the actions that we're facing now. There's been a lot of discussion around playgrounds. And in the state order, there was an encouragement for folks to get outside and exercise. It's important for your physical health and your mental health. Obviously, we don't want to do that in groupings beyond, again, those folks that you live with in your household where it is possible to avoid it. But I want to thank the governor and the state of California for making an adaptation to the health order, for making a change to allow our kids to be able to get out and utilize playgrounds. 3 of our 5 are Zoom learning from home, and the ability to go down to our neighborhood park and let them get some exercise and run around, play on the equipment is vitally important. And so I want to thank everyone who engaged with the state of California in a constructive way, who made the case that playgrounds should be open and that they can be done responsibly. And for all of us as parents, now the obligation is on us to make sure we use those playgrounds responsibly. You need to get your kids out. They need to get some exercise. They need to get some fresh air. We don't want them mixing with multiple households in the same place. Let's go. Let's do it responsibly. Let's go home. And let's really hold true to the spirit of the regional stay-at-home order, which is to try and limit the interaction between multiple households as we try and get this under control. With that, let's jump into our charts for today. You see an incredible testing effort. I want to commend the entire region for this, both our public health lab, our health system partners, everyone who's out there. We continue to be far surpassing the statewide average in San Diego County for testing, 7-day average of more than 24,000 daily tests being performed, working through every challenge and roadblock and obstacle. Obviously, increase in cases is not just because of an increase in testing. You see there the 7-day percentage of positive new cases now 7.4%. Total tests performed over 2 million. Case investigations, they continue to be a challenge with such a massive increase. We are moving to bring on more staffing, and we think this number will begin climbing, and we will get back caught up. But it is very difficult when you see such an exponential rise in cases. And then close contacts, again, continue to be performed well. Turnaround testing times, we've been reporting these very transparently for some time. And again, a huge debt of gratitude to our public health, our hospitals, our county Helix partnership for ensuring that these turnaround times on tests remain low. It is vitally important to the entire integrity of the real purpose of a test that we can quickly turn this around and notify people, and so we will continue to monitor those. Today, as I mentioned at the outset, we're reporting 2,104 new positive cases out of the 25,000 tests done today, 8% percentage of positive. And there you can see on the purple line the increasing percentage of positive, which shows us what's happening. And then, of course, this chart on hospitalizations, you see our ICU numbers there in yellow, total hospitalizations continuing to climb. We know that there is a delay, 21 to 24 days between increase in hospitalizations to increase in cases, which is why we really have to hunker down the next few weeks. Could be challenging as these numbers could continue to grow, even if everyone is taking action to slow the spread. But it's why we have to start now. Next one, you'll see total COVID hospitalizations on the bottom there at 915. Total healthcare system in our hospitals, as you'll hear later, are doing a lot of things to try and ensure capacity and do everything possible to maintain the integrity of our healthcare system. And then the last point you'll see here is just our ICU capacity. Again, we're sitting right there at 80%. You do see day-to-day fluctuations, but in general, this is something that we want to focus on and a primary of concern as we move forward. That concludes my update. I'll now turn it over to Dr. Wooten for a public health officer's update.